I feel like quoting Dickens here. It's the best of times. It's the worst of times, Dr. Fauci. The vaccines are here. It's on one hand, I can feel the excitement in your remarks yesterday. And yet, as you were trying to get people to like, this is not the time to just sort of relax. I got to ask you this. Why was Thursday, November 19th, the first public briefing from the task force in months?
Chuck, I can't explain that. That's I don't make those decisions. We meet, regularly. We discuss the first public discussion. I can't tell you why. I think very likely it was a confluence of a couple of things that the vice president and the task force wanted to make apparent. And I think you very aptly said it. Part of it was the best of times and part of it is the worst of times. We're clearly involved now in a very, very difficult surge here throughout the United States and even globally. When you look at the number of infections that are going up, they're really breaking records in hospitalizations and numbers of infections per day. So that's the thing that's the worst of times. The best of times is that we have some very, very promising information regarding at least 2 vaccine candidates that have a very high degree of efficacy. And the point that I was trying to make at the White House press briefing was to get people to understand that we've really got to pay attention to the public health measures that we are not uniformly implementing throughout the country. It's disparate. Some are doing it and some are not. They're very simple. The wearing of masks, the physical distancing, the avoiding congregate and crowd sessions, activities, particularly indoors, trying where possible to do things outdoors as opposed to indoors, and the frequent washing of hands. They sound so simple, Chuck, but they do make a difference. So the point I was making is that we are in a very serious situation, but we can do something about it. Point number 1. Point number 2 is that help is on the way. Traditionally and historically, highly efficacious and effective vaccines have crushed epidemics like smallpox and polio and measles. We can do that with the vaccines that are going to be coming online. So we should make them be, one, an incentive to have us double down even more with public health measures until we get the full component of the health that's on its way. That's the point I was trying to make. Recognize the difficulty of the situation we're in, do the public health measures, but be prepared for some serious help that we will get from the vaccines.
I'm trying to figure out when we're going to plateau before March. And I say this because you look at the numbers now and you see we're not seeing a bend yet. We have Thanksgiving coming up. I have read that TSA expects as many as 6 million people to go through traveling a day during this, which just seems to be bonkers to me. I apologize there for that side comment. But you look at where we're headed, there is no mitigating event and there's no evidence that we're mitigating a thing. Where does this case count escalation stop? When does the hospitalization escalation stop? Are we really staring at until the vaccine?
It doesn't necessarily have to be that way. We're not going to completely eliminate it and turn it around rapidly and dramatically, but we can prevent it from increasing. You look at the curve, Chuck, it's almost exponential when you compare the curves in the spring and the curves in the summer with the inflection of the curve where we are right now. We should not accept that we can't do anything about that. Putting vaccines aside for a moment, which will be extraordinarily helpful, if we implement the simple public health measures that I was mentioning to you, we can blunt that inflection. It doesn't have to be as high up. You brought up the issue with the holidays. I think the people in this country need to realistically do a risk-benefit assessment. Every family is different. Everyone has a different level of risk that they want to tolerate. But when you think of the holiday season, and the congregating indoors at what are innocent, lovely functions like meals with family and friends. You've got to at least think in terms of evaluating, do you have people in your family that are elderly that might have underlying conditions like someone on chemotherapy or other things that weaken their immune system? Do you really want to get a crowd of 10, 15, 20 people, many of whom are coming in from places where they've gone from crowded airports to planes, getting into the house? I mean, those are the things that have been such joyous things in the past. But this is a very special situation. So you don't want to call it all off, but you want to say at least give you and your family the benefit of having considered what is the risk benefit of doing that, as opposed to constraining what you do to the very core people who live in your home. You just need to consider it and make your own decision.
Should we be here? We're in a dark, bleak place. Was this preventable, number one? And is this on us, the American people, or is this on us, the federal government?
You know, it's very difficult, Chuck, to make those kinds of judgments. I mean, obviously, there were things that went on, that have gone on, that have been, you know, disturbing to me was the lack of consistency of what we've done. One of the things that has been, you know, clear to me that could possibly have been contributing to this is that one of the great things and beauties of our country is this federalist approach where the states can do things individually and they have their own leeway to do things and make decisions. There's good things about that because the states differ in so many ways that you want them to have that independence of being able to do what they feel is best for the state. But when you're dealing with something that's an extraordinary outbreak of an infectious disease that doesn't know state boundaries, that doesn't know county boundaries or city boundaries, then you got to pull together as a whole and do things consistently. Some have done that. Some have done it well, but it hasn't been totally consistent throughout the country. And I think for that reason, we never really got, for example, down to the lower baseline that we wanted to be at. But, you know, unfortunately,
right.
You know, we are not alone in this. If you look at what's going on in Europe right now, this combination of COVID fatigue, of people feeling they just can't take it any longer, having them do risky things that are leading to surges. I think one of the confusing issues is that people think when you're talking about masks, when you're talking about distance and avoiding crowds, that you mean shutting down the country or shutting down the economy. You don't need to shut down. We're not talking about shutting down. We're talking about the consistent implementation of public health measures, which unfortunately, we've seen that in a disparate, spotty way. We haven't seen it consistently across the country. That's just a fact, Chuck. It's not anything that I want to say or that we're making up. It's a fact.
Well, I mean, I guess the question I have is it national leadership was the missing piece? Because we've been here before. We've always had the 10th Amendment since we started the Constitution.
You know, but Chuck, that then gets into political issues that I just don't want to get into, because then
I get it.
That just tracks from what I want to say.
No, and I get that. It's just hard not to look at that. I'll just be honest with you. Let me ask you about testing. Believe it or not, and I'm hear the anecdotes, it is still not easy to get a test, and it's not easy to get a test quickly. And you have said yourself, or I think earlier, that you regret, that's one of your early regrets, is sort of our testing strategy. Explain.
Yeah. You know, Chuck, what I would have liked to have seen done, and I had articulated this and it didn't go very far, is the idea about testing to determine if a particular individual is infected so that you can identify, isolate, and contact trace. I'm all for that. That's fine. But I'm also for what I've said months and months ago, that we should be flooding the system with tests to determine the penetrance of the asymptomatic spread. We don't have that availability of tests. We should have tests that are point of care, sensitive, specific. You can do at home. You can get the results yourself so that you can know when you wake up in the morning, when you want to go to work, whether or not you are infected or whether the people you might want to invite over your home for a holiday are infected. We don't have that. We should have that. I hope we do get that. That has been something that has not been within our grasp. I know technically it's not the easiest thing to do, but I wish we had done that.
2 more questions for you. If President-elect Biden asks you, the current coronavirus task force, Dr. Fauci, should I keep it intact and supplement it with my people, or should I build a new one? What would you recommend?
Yeah. You know, Chuck, I'm sorry, I'm not going to answer that question because that's going to be up to the incoming president. I mean, the one thing that's very, very clear that I've been doing this right now, as you well know, for 6 administrations, and I look forward to continuing to do it. But those decisions are going to be up to the incoming group.
Fair enough. Final question is this. When would you get on an airplane? And when would you recommend people getting on an airplane comfortably?
Well, I think that gets back to the answer to one of the questions I answered to you just a bit ago, Chuck, and that is each individual person has to make a decision based on their own evaluation of the risk-benefit determination. My age, as you know, people don't like to talk about their age. I'm going to be 80 years old in a month. So I may not look it, but I am. I thank you. But I am that. Yeah. So the issue is, do I really want to take a risk like that? It depends on what it's for. If it's something that's extraordinarily important. But right now, the job that I'm wedded to, that I'm devoted to 24/7, doesn't require my getting on a plane. So I don't know what reason would be for me to get on a plane right now. Maybe as we get vaccines and the level of infection goes way down in the community, which I can tell you, Chuck, it will, when we fully implement vaccines, then I'll get on a plane and I'll feel comfortable. But right now I have too much to do right now here in Washington, D.C.
Well, I abide by if Dr. Fauci's not ready, I'm not ready. And when you're ready, I think a lot of people will feel comfortable. Anyway, Dr. Fauci, as always, sir, I appreciate you coming on and answering the questions that you can. It's always helpful to us. Thank you.
Thank you, Chuck. I appreciate you having me on your show. Thank you very much.
Hello, YouTubers. If you're watching this, it means you've checked out our channel, so thank you. Now do me a favor, subscribe by clicking on that button down there. Click on any of the videos to watch the latest interviews and highlights from MTP Daily and MSNBC. You can get more Meet the Press content every morning in the First Read newsletter. If you're tired of content that you don't know anything about where it came from, you don't have to have that problem with us. NBC News, MSNBC, MTP, and the Meet the Press mindset right here for you on YouTube. Subscribe now.